In this video, we are going to discuss some advantages of using a bottle, major disadvantages of using a bottle feeding, what precautions to be taken while feeding your child through a bottle, and most importantly, how to wean off your child from bottle. The advantages of bottle feeding are mainly in terms of comfort and convenience. Where it's not possible to direct breastfeed the child, bottle comes as an alternative. If the caregiver is not able to feed with a katori chammach or palada or suti feeding or sippy cup, then bottle feeding option is easy. Also, feeding in public, feeding while traveling becomes a bit easier. The disadvantages of bottle feeding are many. To begin with, if bottle feeding is introduced early in life, usually below 1 month of age, it can lead to nipple confusion. And in those conditions, baby can completely stop direct breastfeeding. Bottle feeding also is related with overfeeding. Because of that, baby can have frequent spit-ups and increased colic. Bottle feeding is related to a lot of serious infections, usually diarrhea and vomiting related to not cleaning the bottle properly. Tooth decay or dental caries is one of the serious problems which bottle feeding kids face. Bottle feeding also is associated with frequent ear infections, cough, and cold. Bottle feeding can lead to malalignment of teeth or malocclusion of teeth later in life. To avoid nipple confusions, bottle feeding can be introduced a little late, which is at least after 1 month of age or when you are sure that breastfeeding is established. Anticolic nipples can help with the tummy issues to some extent. Never make the child feed flat on the bed. The child should be propped up, that is, his head, neck, and chest area should be raised. Never leave the child alone with the bottle. Always make sure that after feeding, the area of the gums is cleaned with wet cloth. Bottle should be sterilized after every use. Use a good quality bottle sterilizer and nipple cleaning brushes. Frequently change the nipples. The weaning of bottle or stopping the bottle should be planned from 6 to 9 months onward. Introduce your child with a sippy cup, open cup or sippers from around 6 to 9 months of age and offer him milk, water or juice. Gradually replace one bottle feeding with open cup feeding or glass feeding by 12 months of age. So the daytime feeding should be completely off bottle by around 15 months of age. Remember, the nighttime bottle feeding is the tough one and the last one to go. Once you have decided to wean off your child completely from bottle at night, start with breaking the association between sleep and bottle feeding. To do that, make sure that the bottle feeding at night is done in another room. There should be a gap of at least 1 to 1.5 hours between sleep and bottle feeding. After feeding the child, do his nighttime routine in terms of bathing, changing his clothes, reading a book to him, and then take the child to his bedroom. If a child is above 18 months of age and still refuses to let go of his nighttime bottle feeding, the best way to go ahead is go cold turkey, wherein remove all the bottles from the house. Prepare your child during the day by gently telling him that he might not get any nighttime bottle feeding because there is no bottle at home. Have the family support you need around and be firm and consistent. Remind yourself that these 3 days would be tough but would be benefit for your child. The first day, he's going to throw a lot of tantrums, cry a lot. Second day would be a bit better. And third day, he would have a sound sleep without the bottle. Remember, the more delay you do in weaning from the bottle, the tougher it'll get.